Hello and welcome to the Health and Wellness Show, the show that inspires you, empowers you, and informs you to take control of your health. My name is Chebet Birir, but before I continue, I'm so thrilled to be joining you as your new host, and I'd like to give a huge shout out to the incredible Ali Zaitun, because her dedication and her passion has brought this show to where it is right now. And Zaitun, wherever you are, we want to wish you all the best in your endeavors. Now, let's dive right into today's topic, which is respiratory papillomas, or recurrent respiratory papillomatosis. And this is a serious, it's rare, but a serious condition that affects the respiratory system and affects the airways and also affects the voice box, that is your ability to speak properly or normally. And in studio with me today, I have three people who are going to help us understand this topic more. To my immediate right is Dr. Reuel Maina, who is an otolaryngologist. That term, but in simple terms, an ear, nose, and throat specialist. So he deals with your respiratory system, or ears, nose, and throat. We also have Consolata Wairimu Gishugo, yes, who is a nurse at the Kenyatta National Hospital. She's been treating RRP patients for the longest time, so she'll help us understand the disease better and what it takes to take care of patients who are going through or who are living with RRP. And to my extreme right is a very brave, courageous, and resilient man. His name is Okombo Charles. He's been living with RRP for more than 45 years. Karibu sana, Charles, Consolata, and Dr. Reuel.
Thank you.
Now, let's dive right in. What is RRP? What is respiratory papillomatosis?
So what we call recurrent respiratory papillomas, it's basically growths that occur, we call them benign exophytic growths that usually occur in the respiratory system. But majority are usually found in the larynx, over 95%, what we call the voice box.
Yeah.
So they can be found anywhere from the nose up all the way up to what you call the bronchi in the entire respiratory system.
The bronchi is found in the lungs.
The bronchi is now goes now to the lungs.
Goes to the lungs.
Yes.
Okay.
But majority of what we call recurrent respiratory papillomatosis usually found in the voice box.
Okay.
Yeah.
So what causes it exactly?
So we have a virus called human papilloma virus. So it's the one which is actually the causative agent of this disease. We have very many HPV subtypes. We simplify it as HPV for the purpose of this discussion. There are almost over 180 HPV subtypes. But the ones which are more, which is commonly seen in this disease, it's HPV 6 and HPV 11. Others can be found as rare entities, but majority are 6 and 11. Yeah. What
is the mode of transmission, or how do you acquire it? I know it's HPV now, as you've explained, that causes it.
Yeah.
But what, for example, how did Charles acquire it, or how can you acquire it specifically?
Yeah, so we have risk factors. We have several theories, but none is a definitive answer to, what really causes, how it comes about. But we normally talk about vertical transmission from mother to child. We have some risk factors involved, like they usually say a young mother. If you have also a condition called genital warts, tends to occur also more in the low socioeconomic status as well. Also, other viruses like HIV can be also a risk factor, but it's not really just a risk factor, but it's not a cause. Okay, so overall, we just say it's just to be a bit more scientific. That virus, what it does, it acts on there's something called lamina, the basal lamina in the voice box. So that's where it settles, and that's where it now starts those growths that we see in the recurrent papillomas.
Okay.
Yeah.
I know you said it's rare, but how rare is it? What, for example, in Kenya, how many people have RRP?
So, in terms of Kenya, we have around, I think, around a database of around 300 patients, 300 to 350 patients with it. the incidence globally is usually around 4.2 per 100,000 for children and 1.8 per 100,000 in adults.
Okay.
Yeah.
And you've said it affects mostly, is it mostly adults or mostly children?
It's primarily affects children.
Children.
Yeah.
So let's just explain to us more, how do children acquire RRP?
So normally it sets around, you can find around 4 years of age. That's the average time probably we mostly diagnose it. They usually set out, like, let's say a year before now we come to the actual diagnosis, because it's the repeated clinical visits, because of how they present. But how they acquire it, it's still a matter of debate. Its research is still ongoing concerning that. But as I said earlier, it's that vertical transmission that we suspect from mother to child. Yeah.
All right. Nurse Consolata, tell us, what are some of the signs when patients come to the Kenyatta National Hospital? I know it's also Dr. Riwell who diagnoses it, but what are the signs that people should watch out for?
Hoarseness of the voice and strained breathing. There is also failure to thrive, and at times there is a stridor, which is a pitch-like sound you get from the child. Those are the major ones.
Okay.
Yes.
We also have other conditions that present the same symptoms, right? So how will you define that this is RRP and not asthma, for example?
It debates with the history of the mother. The mother will give a history of prolonged difficulty in breathing. Others will talk of the patient not able to breathe, even after being given medication. There's also repeated treatment of upper airway obstruction, upper airway infection for quite some times. Sometimes they are treated for pneumonia, which is chronic.
Okay.
Yes.
Charles, will come to you shortly, but allow me to ask Dr. Riwell, what are the treatment options that we have at the moment?
So in terms of treatment options, it's usually surgical. There is no cure, just to be clear on it. There's no cure. But now we usually do surgical excision. We can use what we call cold steel. You actually do what you call a direct laryngoscopy. Basically, a patient like a combo is put in theater, and then there's something called a direct laryngoscope, and then we can either use an endoscopic tower or a microscope. Okay. So you can either use, maybe just to simplify for the audience, cold steel, basically it's like instruments just to pluck them out. You can also use something called a microdebrider. It acts like a slasher, it debrides, and then you can also use laser as well.
Okay.
Yeah.
So a laryngoscope is it like a camera that goes into the throat?
It's like, yes, so it's an instrument that what actually does, you put it through the mouth, and then you suspend it. And then now you're able to work with your instruments through that as you are working on the voice box.
On the voice box. How long is the surgery?
Roughly like an hour.
An hour?
An hour or so, yeah.
Okay. Do you consider it a major or a minor surgery?
It's a major surgery because of the risk that it carries. Remember, it's acting on the airway and it's blocking the airway. So sometimes it can, even in theater, you have to be really careful and you have to really prepare for it. Sometimes even an ICU bed is usually reserved for them because of the risk of airway compromise. Yeah.
Okay. So it's a very serious
It's a very serious surgery. Yeah, it's a very serious situation.
Somebody like Charles has gone through more than 200 surgeries. Congratulations for the bravery and the courage to actually come and talk to us about that condition. So maybe just talk to us, how has your journey been? When were you diagnosed with RRP, and how has it been since you got diagnosed with it?
Well, it started when I was a little boy, around 5-6 years. Yes. From then,
All right. We'll come back to you, Charles, as they work on your sound. But Daktari, how long? You said it's recurrent and it's not treatable.
Yeah.
And somebody like Charles has had it since he was 5 years old. What is the journey like for a patient? And then we'll come to you, nurse, because you see these patients on a daily. So what is the journey like as a doctor seeing these patients coming to get treatment?
Yeah, so as Sister Consolata told you about, they present with that hoarseness first, and then they now get into that difficulty in breathing, and that's how. And then there's something called a flexible nasal endoscope, which you use to diagnose it. Then you go to theater, then you remove. And so what happens, in some patients, they undergo remission. Maybe after the first 2 surgeries, 3 surgeries, it never comes back again. Now there are those patients like Charles, which is now recurrent. And it takes, now for him, now it started as juvenile onset. And now he has grown with it into his adulthood as well. And so there's those patients who it recurs. There are those patients who undergo spontaneous remission. And there are those ones who they can stay for a longer period of time without a recurrence, even 5-10 years. Then they get a recurrence again. Okay. So it's variable. It's variable
from patient to patient.
Yeah.
Nurse Consolata, how is it? You see about 350 patients at Kenyatta National Hospital. Most of them who are children. How is it seeing these children struggling with RRP?
At times, it is difficult because these are the children who would like to play like any other child, but there is no voice. They are children who would like to walk and be at school with others, but most of the time they are out of school because they have to visit to the hospital. The other aspect of the parent, majority of the parents before we came in, they did not know what kind of a disease it is. Once they are told that they are going to live with this disease, it is difficult for them, and they are not able to cope with it when they are alone. For the children, when they reach at the age of 5-10 years, they start asking themselves, others, why am I? They ask their parent, why is it that I'm always in hospital? Why is it is only me who is being injected? Sometimes they become hostile and irritable to a point that the mother keeps on crying. And at that time, they need a support to lean on.
Wow. And so you've mentioned support. What options of support do you have? Do you have counselors, or how do you walk that journey with these children and even adults who are struggling with RRP?
We involve the services of speech therapists to assist these children to regain their voices. We also involve the care of psychologists, clinical psychologists, to work with the children and their parents. We also involve nutritionists in it, and also giving them first-hand information about the disease. And then we give them an avenue to talk about their challenges and how they overcome them.
Okay.
And then we bring them together as a support group.
You mentioned that you have a support group, actually.
Yes.
So in that support group, is it on WhatsApp or you meet physically?
We have a WhatsApp group, and we also meet physically 3 times in a year.
3 times in a year.
Yes.
Okay. So when you meet, how do you go through it? How do you go about it? Do you talk to them, or do you let them speak out? How does it go about?
We first let them speak out. Each individual explains their history, their life history, the challenges they are encountering, and then they learn from each other how they overcome these challenges. After that's when we involve the psychologist to assist them to overcome their emotions.
Okay.
We also bring in speech therapists to the, especially to the children, to help them improve their voice. Yes.
And how do you support children and even adults before the surgery and after the surgery? Because like Dr. has said, it's a life-threatening. It's not, you're not sure that when you go for surgery you'll come back alive.
Yes.
Is that right?
Yeah, well, yes. Part of what the consent taking we give to the parents and to patients like Charles is, you know, it's a severe, it's a high risk surgery. So sometimes, of course, you know, talking about fatality, death, it can be very challenging, but you have to explain it to them. So yeah.
So you make them understand.
You make them understand that this is a serious condition. However, it's also a manageable condition. Yeah.
And what role does that play? Like, does it have better outcomes? Because I know you'll find patients who will be afraid of going for that surgery. So what are the outcomes of you explaining to them that this is a risky affair?
So what we are trying to do now, we don't want them to come as emergencies. We don't want them to come when they are very obstructed and in severe respiratory distress. We want them to come what you call electively, planned surgery. Like, let's say if I operate on Charles now and I find that he has these growths on one side, or let's say they're on both sides, I would want to remove one side first and then tell him to come after 4 weeks or 8 weeks. Then we remove the other side. Now, the problem that we have in our setup is that because of the financial challenges and other factors, they usually come now when they are really, really obstructed. Yeah, so you're rushing to theater and trying to, you know, save the situation as it is. Yeah, but we want to do them planned, not as emergency.
All right, we'll talk about the costs in a few.
Yeah.
But I'm told now Charles' microphone is okay. Charles, you were telling us your journey, how you were diagnosed and how it has been for the last more than 45 years or so. How has it been?
It's been hectic, to be precise. It's not easy.
It's not easy.
Yeah, the most important thing is that you have to accept your condition.
You have to accept your condition.
Yeah, that's all.
Like you have accepted your condition
I
now.
accepted it. That's why I'm here. Yes.
Thank you so much for coming, and thank you for sharing your story. And I know this will encourage other people out there who are going through the same to, you know, seek help and learn that they are not alone, that it is manageable.
Yeah.
So Charles, tell us, when you go through surgery, does your voice come back temporarily, or how is it after surgery?
No, it doesn't come back.
It doesn't.
It stays the same. They create the airway, but the voice remains the same. Yes.
And were you born like that, or you acquired it after birth?
No, I was not born like this.
You
I
weren't.
had a voice. Yeah.
You had a voice before.
Before I had a voice.
Okay.
So it disappeared when I was about 5-6 years, when I started going for medication.
When you started going for medication.
Yes.
And who was there with you? Was it your mother or your father?
No, my mother was old. So I was taking my sister, my elder sister.
Your elder sister.
Yes. She took the full responsibility. Yes.
Okay.
The journey was long. We started all from some hospital in Isebania. From Isebania, we were referred to Homa Bay. Homa Bay, we were referred to Kisumu. And then Kisumu finally to Kenyatta. Yeah, that's around 1977.
1977.
If I can remember,
Yeah.
Yes.
You've come a long way.
I've come a long way.
So how has the cost implications, how much has it costed you to treat that condition? Because I know 200 surgeries, that's a lot.
It has costed me dearly. Yes, but I was using friends. By then, there was no NHIF.
There was no NHIF.
But that duration, the hospital, we used to pay only 20 shillings by then. Even if you stay for a longer time, on discharge you only pay 20 bob.
20 shillings. Then
Yes,
you
20
stay for a month.
For a month you pay 20 shillings.
Hey, siturudi tu huko jamani. Yeah. So, but now times have changed.
Time changed. And the NHIF So I've been using it, NHIF.
You've been using NHIF, and
Yes.
now it's SHA. It's
Now
no
it's
longer
SHA.
NHIF.
Yeah, it's no longer NHIF.
How is it? Is SHA working for you?
It's working because since it was introduced, I've used it about 3-4 times.
3-4 times.
Yeah, 3-4
And
times.
all those times you went for surgery.
Yes.
And how much did it cost you?
112,000 per every surgery.
For every surgery.
Yeah, for every.
And how much do you pay, and how much does SHA pay?
It clears all the bill.
It clears everything.
Yeah, it clears everything.
Okay. So SHA is
But
working.
it's working, but the challenge is when we tried to pay for June, for the month of June, 2025, this current month, we got a message. It was rejected. The payment was
The
rejected.
payment was rejected.
Yes.
And how much do you pay? You pay every month.
Yeah, we pay every month.
And how much do you pay?
I use my wife's account. She pays 550.
550.
Yes, and she registered in December. We've been updating every month. But when we tried this month,
It rejected.
it rejected,
And have
and
you?
they were telling us to pay those areas,
Okay.
3,000 and 3,800.
But you've been paying since.
Yes, we've been paid, and that's why they've been discharging me. Yes.
So have
The
you?
last surgery was in April.
In April. You
Yes.
had your last surgery in April.
In April, yes.
And have you found help in terms of why it has been rejected and what needs to be done?
I was planning to go to their office tomorrow
Okay.
because it happened over the weekend.
It happened over the weekend.
Yes,
And I
yes.
understand you're due for surgery.
On
Wednesday.
Wednesday, yes.
I wish you all the best, and I hope they reconcile and solve everything for you.
Hopefully, hopefully.
All right.
So what happens to his
To
voice
voice,
box?
yes.
The reason, just for the audience, because now they are hearing that hoarseness.
Yeah, and it's why.
Yeah, and that's why he has a
whispering.
microphone now
Yes,
and he's
yes,
whispering.
yes.
It's because now, because of the repeated surgeries, you get a lot of scarring around the voice box. So his voice is never, the voice box, the vocal cords don't vibrate very well. And because of that scarring, that's why he has that persistent
Okay.
hoarseness. But for him now, mostly it's to make him have a good
Airway.
first.
So
yes.
the voice may never come back.
The voice, unless we try some augmentation procedures here and there, which can be done. But for him, the priority is to restore the respiratory function
the
first.
breathing.
Yeah, the breathing.
And Charles, do you feel pain when you talk or when you breathe? There is no pain. Okay.
Pain at all.
Okay.
Only the breathing.
Only the breath. When you breathe, you feel pain.
At times, I have chest pains.
Okay. Sorry about that.
But not severe.
Okay.
Yes.
So do you take painkillers for that, or you just?
No, I don't take painkillers. When I detect that symptoms, I rush direct to the hospital.
Thank you for being so strong.
Yes.
Let's now come to Nurse Consolata. What does it take? What does it take to see these patients who? I know Charles is brave, but I know we have patients who give up along the way. Sometimes I know you may find patients not coming back. Is that the case?
Yes.
How is it? And what can you tell them?
They would just tell them to follow their clinic. We have taught them to observe the symptoms so that they can come early enough before they are blocked completely. And one of the major signs that we tell them is hoarseness of voice, refusal to feed, the child stop playing with others, and also there is exhaustion. When they walk, you see they feel tired. They also express headache. At that point, we tell them to come early. We also have a WhatsApp whereby they ask Dr. Maina questions direct. When they get some symptoms, they use the WhatsApp group.
Okay. Dr. Maina, does it help to diagnose it early? Or?
Yes, it does,
Okay.
for sure, because the earlier you diagnose it, then the chances of also doing a recovery in terms of however it might the pattern it might present with, the chances of recovery are usually better. Yeah.
Okay. Now let's go to the cause, which is human papillomavirus. And I know one of the ways to prevent HPV is vaccination.
Yes.
how effective is this vaccine, and what can we do about it to ensure that people get vaccinated before it's too late?
Yeah, so vaccines have now become key. Basically, Gardasil 9 vaccine is the one which we are trying to advocate to use. The Western world have actually a program for boys and girls with this vaccine, and they've actually seen success in terms of what the vaccine does. It reduces the rate of recurrence. It doesn't prevent.
It doesn't prevent.
But it reduces the rate of recurrence.
Okay.
So let's say instead of having like 3 or 4 surgeries, you can just have 1 or 2. And we are advocating for it. We are riding on the success of obstetrics and gynecology. They are the ones who developed this program because of cervical cancer. And so the Gardasil vaccine at the moment is inaccessible to majority of our patients because the cost is quite high for them. It's around 16,000 Kenya shillings, and you need 3 doses.
Okay.
Yeah, you need 3 doses in an interval of 3 months. So that will come to a cost of 48,000, 50K. And so what we are trying to do, we are just writing letters here and there with Sister Gishigo here, so that we can try and get the government or the various bodies to try and subsidize it, because it makes a difference.
It does.
Yeah.
And that leads me to now the next question, and I want to pose this to all 3 of you. What can the government do to ensure, one, people are informed about RRP and they're able to prevent it and also manage it when they're diagnosed with it? What does the government, what role does the government play in this?
Actually, the government is actually the main player, plays the biggest role. So I think from trying to cover these patients using SHA adequately, sometimes there used to be a time NHIF had a limit in terms of the number of surgeries you can do, but now that doesn't fall for these patients because they can have quite unlimited number of surgeries in a year. Number 2, also to make sure that this vaccine is accessible. We get some support in terms of equipment from where we work, but we still can do more, of course. And number 3, it's just to make it. Most of the clinicians need to know about it so that we can be able to diagnose early. So basically, advocating for educational programs through our emergency departments, so to have a high index of suspicion for this kind of disease. Yeah.
And I know I want to take you back to children, because that's a very sensitive area. What are the risk factors, for example, for somebody like Charles who was diagnosed at 5 years? Can a child be diagnosed at birth, or how rarely
does it occur at birth? Usually it comes at around 3-4 years there. That's when you start seeing the child having
even if it was
hoarseness.
Transmitted at birth through the mother,
it doesn't present that time.
Manifest later. Okay. Yeah. So what are the risk factors of the diagnosis in a child below 5 years, for example?
Well, apart from the ones during birth, there are no real risk. There are no other risk factors. Environmental factors don't really play a big role in it. None has been proven yet. And so what we just advocate is once you notice the hoarseness, that's when you should now come to us.
Okay.
Yeah.
All right. Now, Charles, we're about to take a break, but when we come back, you'll tell us about, you'll talk to someone who maybe has been diagnosed with it and what they can do to prevent it, or what they can do to manage the condition, to just encourage someone. And we'll also talk to nurse, and you'll talk to them and explain to them what are the steps of diagnosis and treatment and how often can they come. And then Daktari, you'll talk to us about the average number of surgeries that a patient can come. I know it varies from individual to individual, but averagely, how often will you see one patient?
Okay.
Sawa. Thank you so much again for being with us on this show. And we're going to take a short break. Don't go away. When we're back, we'll still have Dr. Maina, Consolata, and Charles Okombo. Welcome back. If you've just joined us, this is the Health and Wellness Show, and today we are talking about recurrent respiratory papillomatosis or papillomas. And in studio with me, I have Dr. Riwel Maina, who is an ear, nose, and throat specialist. I also have Consolata Gishugo, who is a nurse at the Kenyatta National Hospital. Last but not least, I have Charles Okombo, who is a patient living with RRP for more than 45 years now. And before we went for a break, we were talking about the role of the government in handling RRP. And now we want to talk about first the challenges that as a patient Charles has gone through, and then later on he will encourage similar people who are going through RRP in the way Charles is going through, or who have just been diagnosed. Basically, you will just help us to encourage those people who are watching and are suspecting maybe they have RRP, or they've just been diagnosed and they don't know what to do. But first, let's start with the challenges through all these years. What are some of the challenges that you've been going through, and how easy or hard has it been to navigate them?
It hasn't been easy on me because it affects you from schooling. Because of on and off, going to the hospital frequently, it affects your schooling. On the other hand,
so how did it affect your schooling? Let's say from primary school, how was it? At the age of 5, did you understand what you were going through?
I did understand because they approached me and they explained to me what was happening.
To you. Okay.
So I understood. So that's why I understood why I was going to hospital. Yes. So the process of off and on from schooling.
So how did it affect your social life, especially now from schooling to high school to did you go to university? If you went to university, how has it affected your social life also?
You know, as for me, I learned to keep quiet when people are talking, people are giving views. When people are interacting, you have to keep away from the group. Because if you talk, people will be wondering, hey, na huyu anaongeaje?
Okay.
Yeah. So it affects you deep inside you. Yes. So you have to keep away. Yes.
And in terms of maybe dating or marriage, are you married?
Yeah, I'm married.
Awesome, yes.
Three
So
kids.
how has before you met your wife, was it challenging to meet someone?
No, in fact, they love the voice very much. It didn't affect me much. But raising a family with a voice like this, your kids are wondering, why is our daddy talking like this, and the others are. So you have to keep on telling them, I'm like this, I'm like this.
So you now your children understand. How many kids do you have?
I had 5, but I buried 2 daughters
Pole
at
sana.
a tender age.
Sorry about that.
Yes, so I'm remaining with 3, 2 daughters and a son.
How old are they?
17,
17,
8 and 15.
And 15.
Yes.
And do they understand why dad speaks like that, or why?
They do because I explain to them, and they see I'm going to the hospital frequently. So you have to explain to them. You have to be open to them. Yes, because if you don't,
They'll ask questions.
they will ask questions. Actually.
Okay.
Yes.
So, any other challenges apart from the social life? What are the other challenges that you face?
Challenges when on the job line.
Work.
You go for interviews. They say you've done better, but your voice. We need somebody who can speak up. Yes, with our customers.
What is the nature of your work?
I'm a driver
You're a
and
driver.
a clearing agent.
And a clearing agent.
Yes.
Okay.
Yes.
So that they say requires you to speak.
You to speak. Yes.
And
I also tried Uber.
you tried Uber.
Yes, and I was turned down. After 2 weeks, clients are calling, and then they cancel requests
Because they can't hear you.
because they can't hear you. Wewe unaongeaje? They cancel.
Okay.
Yes, and then I had to drop. A friend of mine bought me a car, and so I had to sell the car and refund.
Sell the
Yes,
sorry about that.
Yes.
But eventually, are you working now? How did it finally work for you?
Well, I depend mainly on my friends at the port. We are clearing agents.
Okay.
I help them. If somebody has a job, he calls me. Kuja unisaidia hapa. We clear mostly units, cars. So when the client is in Nairobi and is not willing to come to Mombasa to get the car, I can drive the car and deliver to them. Yes.
Okay.
That's how I survive, through the help of friends. Yes.
All about
and I appreciate them so much. Yes.
It's amazing that you have good friends.
Yeah.
So, Daktari, is it contagious? Like, for Charles, can he transmit it to someone as he is right now?
No,
He
it's
can't.
not. Yeah, no, he can't. It's not contagious.
Okay.
Yeah.
And okay, let's now talk about the treatment options. Apart from surgery, what options are there for treatment?
Yeah, so there's some experimental things that have been tried before. Apart from now the Gardasil, which is successful, the vaccine. So we have, let me just mention them, Cidofovir, interferon alpha, indole 3 carbinol. But the one which we are using more often now in the severe disease is something called Avastin or bevacizumab. So that one can be injected either through in the vein, or it can be injected directly into the voice box. And we are seeing some success in that, but that one we only use it in the severe disease.
Okay.
What we classify as severe is those patients who need an average of like 4 interventions in a year. Those ones which are now outside the voice box, those ones which have spread into the windpipe, the trachea, and or distal spread into the lungs. Those ones who have what you call a tracheostomy. A tracheostomy is a tube. There are some, especially children, who have that tube because now the papillomas are so florid in the upper airway.
Florid
means many. There are many.
Okay. Yeah.
And so they are unable to, even if you debulk, meaning if you remove, you are unable to achieve a good airway, and they need a tracheostomy, assisted breathing to bypass it. So those are the ones whom we advocate for that Avastin. So we coordinate with the oncology department for that. Yeah.
You've mentioned oncology.
Yeah.
Does it mean that they can turn into cancerous tumors?
So it's usually it's a benign condition, meaning
non-cancerous.
It's non-cancerous, but in 1% they can undergo what you call malignant transformation.
What does that mean?
They can turn cancerous.
They can turn cancerous.
There's a 1% chance they can turn cancerous, though it's not so. It's 1%.
1%.
So
okay.
Yeah.
And let's now talk about extreme cases. Do we have people who die from RRP, and how does it get there?
Yeah, we have had a few fatalities because of RRPs. Most of what we experience are those ones who come in a severe form as emergencies in respiratory distress. Some are undiagnosed. It's just that they were being treated for asthma, and then so when they come, it's a bit late, and so some even die even on their way to the hospital. So that's why we're advocating now that whenever you have that, when our clinicians have a high index of suspicion, you're treating asthma, it's not improving, or this child has hoarseness, just send them to the ENT department where we can be able to analyze and see.
Okay.
Yeah.
And what leads to death from RRP specifically? Is it just difficulty in breathing, or is there something else that can lead to death?
Yeah, it's just that. It's basically you're not able to breathe. Yeah.
Okay.
Yeah.
Nurse Consolata.
Yes.
What does it take for patients to come consistently to the hospital? And you'll also talk about, we've talked about treatment options, but treatment options in terms of locations. Understand that Kenyatta National Hospital offers the majority of the treatment. But do we have other options, and what can be done if there are no options in terms of location for treatment to ensure that people have equal access to treatment?
These patients are spread over Kenya, but we advise them to keep, to adhere to the clinics, to observe the signs of recurrence, and also if they are not able to arrive to Kenyatta in time, they can go to the nearest ENT surgeon in their area. We've got so many, almost every county they have an ENT surgeon or a clinic officer who are able to diagnose, and they can get assistance of an ambulance to Kenyatta such that they will arrive in time. Yes.
Okay. And as Kenyatta National Hospital, are you doing anything to educate and inform people about RRP, say in communities?
We have started.
You have started.
And
That's
this is
good.
one way of,
exactly.
of
Yes.
public awareness. And on 11th of this month, we are celebrating World Recurrent Respiratory Papillomas Public Awareness Day. Yes.
So what exactly are you doing? For example, do you go door to door? Do you have pamphlets? Or do you even like the other ways, or like paid advertisements for TV stations or radio stations and newspapers?
Yes. Last year we had two occasions where Standard Media Group, they offered us a page in their magazine for public awareness. The patient expressed themselves in that magazine. The doctor explained about the disease, and we all came together to talk about it. We've not yet been reached to the publications, but we are on the way.
Thank you so much for that initiative. And now, how can the healthcare system, I know SHA is working now, but what are other ways that the healthcare system can better support long-term RRP, apart from now offering the free treatment? What other ways can the healthcare system help?
By assisting in creating the awareness, making the other county hospitals
and healthcare facilities,
to have the instruments to do the excisions, because they have the experts in those areas. Also assist in early referrals to the main hospitals. Yes.
Dr. Riwel has mentioned something like misdiagnosis for asthma and RRP. What can be done, Daktari, to ensure that there's accurate diagnosis so that we save time for the treatment?
So we usually have continuous medical events that we normally organize, various Zoom meetings in hospitals, where we get this topic to be discussed. So improving the clinicians' awareness and high index of suspicion is key to managing these cases. So that's what we are doing at the moment.
Okay.
Yeah.
And how many specialists can treat RRP in Kenya?
So it's
like
basically ENT surgeons. I think we are
ENTs.
around 120.
You're around 120. And they can be able to do that surgery?
Yes, everybody can. Every ENT surgeon can be able to do it.
Okay. And are you doing anything to empower them more in terms of maybe new research?
In fact, we recently had an Airway course. It's called an Airway course. I think 2 weeks ago. We organized with some international partners from Stanford and from Qatar, and so we basically, that's how we are continuous education. So just basically training, retraining, and you can never get tired of training and training and training. So it's basically a matter of reminding everyone once in a while.
Once in a while.
Yeah.
Thank you for the good job that you're doing. Now, what do you think, nurse, people can do in terms of treatment to ensure that they manage it well? And I'm saying this in terms of people who can give up and say, I won't go for treatment, I'm tired. What can you tell them?
there is hope. And recurrent respiratory papillomas is not a death sentence. We have seen our own Charles glow with the disease, and he is able to start for his family. He is a breadwinner. It's just to encourage them and support these young children to live their full life like any other child. Give them support, moral support, give them first-hand information about the disease, and telling them it's not a curse, it's not a family, but it is manageable. Just tell them it's manageable. You just need to come together with other members who have it, and we grow together. Do not hide your child at home. Just come out.
Okay.
Come out and we walk together in this journey. There are people to assist you. We have counselors, we have speech therapists, we have doctors who are allowed you, and it is possible. In our voices together, we can.
For sure. Thank you. Charles, words of encouragement.
I think Sister Kashigo said it all. It's all about accepting yourself. Accepting your child is like this, so you have to keep on fighting, because if you don't fight, you will lose the battle. So you have to go for regular checkups. When the child is blocked, rush to the EMT doctors. They will assist you.
Thank you.
The way they have assisted me, and right now I'm with you here. Very strong.
Thank you so much, Charles. Now, before we continue, I'd like to read a few questions from and feedback from our audience. There's one here by Benjamin, and he's asking, what measures does Kenyatta National Hospital through MOH take to increase awareness to all health workers? I know we've talked about this, but maybe you can emphasize on that, Nurse Consolata, maybe in terms of CHPs, that is community health promoters, and other nurses. What is Kenyatta doing?
There are arrangements for webinars for the healthcare workers. There are also small seminars in the unit. Others, the major one now is the one we have come up now in the social media to talk about it.
Okay. There's another one for you still, Nurse. Do you find families with more than one child with juvenile onset recurrent RRP, recurrent respiratory papillomas?
No. Among the 300 patients that we have so far seen in Kenyatta, none.
So it's not something like genetic or what's the case, Dr.
There could be a genetic component, but still the jury is still out there.
Research is ongoing.
Let's say research is ongoing at the moment.
Okay. All right. And there's a last one here. Charles has been, this is your friend. Charles has been a friend for over 15 years in that condition. So you have your people watching. That's a very good thing. And so thank you so much for coming to speak about it, Charles, for Nurse and Daktari. It takes a village, they say, to, get people informed and empowered. And I'd like to just appreciate you for taking your time to come to talk about this condition. And I hope that you will continue to inform people about it and encourage people about it, so that we can have people informed and educated and empowered for those who are living with the condition, that it's possible to actually live with it, as we see Charles here, very strong, and he's here encouraging other people. And you can have a family, you can work with the condition. So if you are out there and you're struggling, or you're wondering where to go next, and you have just been diagnosed with RRP, feel free to reach out. We have Dr. Charles here, we have Nurse Consolata, and we also, Dr. Rewell, and we have Charles Okombo, who's been living with the condition. Reach out and you'll find help. Thank you so much for tuning in. See you next week, same time, same place, for an hour. I'm Chabet Birir. Have yourself a lovely evening. Stay blessed.